What is the first thing to come to mind when you hear Wisconsin? If you're like me, it's cheese. Cheese wheels, cheese curds, cheese heads, and for good reason. Wisconsin is home to approximately 6,500 dairy farms and produces almost 1.7 million tons of dairy products per year. However, here's a question on which you have probably not reflected. How does Wisconsin achieve this? If you said a lot of cows, you're not wrong. But more importantly are the workers, the majority of whom are Hispanic immigrants and families living in rural communities throughout the state. Like in many rural Hispanic populations in the U.S., these communities face significant disparities in access to quality health care. Thankfully, organizations like the Wausau Free Clinic exist to help bridge this gap. In September of 2021, the Wausau Free Clinic began offering year-round medical services to all low-income and medically uninsured or underinsured persons. Since then, more than 50% of their patients have been of Hispanic descent, many of whom have come from the rural communities surrounding Wausau. However, very little data is available regarding what medical needs exist in these rural communities and how they utilize healthcare services. And that's where I come in. My name is Eric Lee, and as a medical student at Medical College of Wisconsin, Central Wisconsin, I have worked alongside local organizations to meet with people in these rural Hispanic communities in hopes of better understanding their medical needs. Over the past year, I have conducted a medical needs assessment while at community events and at vaccination clinics that target these rural Hispanic communities. These surveys have inquired into individuals' access to insurance, healthcare use, access to prescriptions, and needed or desired medical services. Going in, I expected that a majority of those without insurance would have a strong interest in routine and preventative care. Our results, however, were more ambiguous. While there were many who valued access to routine care and checkups, most people were concerned only with having access to a physician in times of acute illness or injury. What was even more interesting is that this pattern was true even for those with insurance. Despite the ambiguity of some of the results, a lack of access to affordable care was a clear and repetitive theme, as almost 20% of the uninsured owed money for medical services and 25% reporting hardship with paying for prescriptions in the past or currently. Consequently, there is a clear need for affordable and accessible care to a broad base of medical services. As the Wausau Free Clinic plans to move into a state-of-the-art facility as a part of the Wausau Community Partners campus in late 2022, they hope to evolve to match the complex needs of this community. As we look to the future, there is still much room for continued research into the medical needs within these communities, and perhaps a place for outreach and education regarding the benefits of routine and preventative care. I look forward to continuing to work with the leaders and physicians at the Wausau Free Clinic as they continue to promote health in mind, body, and spirit to our underserved communities. And finally, I would like to thank everyone at the Wausau Free Clinic, H2N, and MCW-Central Wisconsin for your help with this project and for your persistent and incredible work to address the disparities in medical services faced by these rural Hispanic communities. So thank you.